Welcome, everybody, to another episode of the Beyond Train podcast. We're joined again by Mr. Emrys Goldsworthy. First time we have the same guest on, and I believe it's certainly warranted. This man's work is really, really amazing. I was fortunate enough to read his book, and I highly recommend it. Gives a great overview of the nervous system, the connections that it play, especially the vagus nerve, of course, central to our discussion last time. I'm really excited to have him back on today. Last time was one of our greatest discussions I think we've had on the podcast so far, and I'm sure we're gonna have another great one today. This man is definitely, I think, gonna be central uh, when we look back in a 50, 100 years. So I'm really, really grateful that we are able to chat with him and have him share his wisdom with us. So, Emrys, thank you so much for coming back on today.
Always a pleasure. Really happy to talk today about this subject, and wherever we go, it'd be great.
Yeah, yeah. So we were just chatting there before the episode started on one of the topics that I wanted to bring up today, and something that we've been talking about a lot was that of German New Medicine. Um, and I think there's a lot of discussion, whether it be from Dr. Hammer and the people who have followed his work, or whether it just be the discussion of the connection of the mind and the our reality, right? Whether how our emotions can get stored in our body, and the effect that has, the effect that our conflicts or our traumas have on our body, on our physical health. I think it's a really interesting topic. I think it's something that, for me, it's hard to escape from, because when I'm looking upstream, I'm looking, and you can always trace it back to a behavior, an emotion, or something of this nature. Like, if you're eating too many toxins or too much food, there's a gluttony aspect there, and it may boil down to greed, right? It comes down to, I think, these psychological components. So I'm really eager to hear your thoughts on this and the connection, and because we always mention the vagus nerve and or the nervous system in passing when discussing the mind-body connection. So I think you're the right man to ask this question to. So I just want to kind of hear your thoughts on that and go from there.
Well, I definitely think that German New Medicine is going to be critical in the terrain paradigm, if you want to call it that. German New Medicine is probably the best explanation of cancer that I've ever seen. Other explanations have been, as like kind of a toxin reservoir or a encapsulation of toxins, or it's a kind of a pseudo liver. I've heard that research as well, where blood goes through the tumor, comes out cleaner, and maybe all of this is correct. Maybe German New Medicine is, and I may kind of bastardize this a little bit, it explains it as a point where different tumors in different regions, and of course this is more relating to brainstem related problems in biological conflict systems, that these tumors are a way for the body to kind of deal with the trauma, almost in a way store it there, and then basically over time eliminate it. And of course, there may be a variety of ways of explaining it, but that essentially these tumors or cancers are a response to a trauma, and they're a way of dealing with it. And that there's two phases: there's sympathetic and vagotonic phases. And I do think that those are very interesting ideas. I do think that they are more than likely correct, that the body has a way of dealing with emotional trauma that we don't fully appreciate, and it is a brain to body connection in the literal sense. There's a lot of this talk of brain-body connection or mind-body connection, and they talk about it in a very kind of not very descript way. It's kind of a bit vague, and I think the problem is that it is more literal. And once we get to the understanding of how literal it is, as it's seen in German New Medicine, we can then better assist people going through these diagnoses. And I think the problem is also the diagnosis. There's the shock diagnosis and shock biological conflicts as well, where people get a diagnosis of cancer and then can develop cancer from that itself. And we also have a problem in the world where people see cancer as something that kills. And I've always struggled with this, because although I get told this a million times and the textbook tells you cancer kills, it doesn't always explain exactly how. And of course, we know that if someone gets something like chemotherapy, the chemotherapy can kill them. I think that's arguable. That's easily shown in the literature. Radiation as well. And of course, surgeries can kill for numerous reasons. And one of the things that I think is very interesting is that, they'll always say to me, well, what about pancreatic cancer? Well, that kills people, within months. I said, well, what exactly kills them? That's my question. And if you look it up, the majority of cases they say are due to liver failure. Pancreatic cancer causes liver failure, and either due to the tumor going into the liver or other reasons. And here's what I mean. Like, if you were to ask someone, how does the cancer kill you? They wouldn't really be able to answer that. It's not a clear answer. So that brings up, and then maybe people will have lots of ideas and they'll say, oh, look, no, it's because of the X, Y, and Z. But can they really prove that? They used to, we've been dealing with that a lot with germs. And unfortunately, the evidence for how cancer kills, I'm not saying it doesn't kill, but how it kills, is not always that clear, because it's full of a lot of convoluted issues, in that it's full of drugs, it's full of emotions, it's full of other therapies that have been utilized to treat said cancer. We don't really know what was the end point and how. And a lot of people will say, like for example, my mother allegedly died of cancer. But the problem is that when I watched the way that she died, it was nothing to do with the cancer. It was actually iatrogenic. And if you are to observe many people in these situations, the treatment is the thing that ends up killing them a lot of the time. And then how many people really die of the actual cancer? And I'm not saying they don't. I don't mean to go around in circles, but it's not as clear. So when you come to, say, the work of Dr. Hammer, and he says it's an emotional origin and that it needs to go through its course, and there are reasons why it may be stalled in the process, and antibiotic use. And it's as soon as we intervene, really, the truth is that if we don't intervene or we don't get in the way, there may be ways of which, and this is what I'm looking into, ways of which we can assist in the process. And I think that's where the vagus nerve does come in. Dr. Harmer didn't place huge role on toxins, although he does mention it many times. I've read a lot of the work on toxins, and at least he will say that toxins damage the nervous system, and that is definitely my view. This is where toxins really hurt you. They hurt you by damaging the nervous system. And many people will say, it damages the intestinal epithelial cells, and that, creates some kind of dysbiotic response, and that's the dysfunction. And the inflammation that's produced is what's causing your disease. Well, there is absolutely no evidence that any of that causes the disease. If you have nerve damage, you will get epithelial cell damage, or it won't repair. A lot of people don't understand this. Without the nervous system actually functioning with the organ that we're talking about, that organ doesn't repair adequately or at all. Everyone thinks it's all about blood flow alone. Well, it's actually also about the amount of nervous system activity in the organ. Okay, so there are numerous studies where we do electrical vagus nerve stimulation as a way to research it. It's a valid way to do that, and we can create kind of more electrical activity than normal. And we see that organs repair at a much faster rate if we stimulate the nerve that goes to the organ. And this is if we damage the organ in experimental models, because this is really the only way to do so. They're animal models, and they are valid because if it works in an animal, then it does almost certainly work in us as far as the nervous system is concerned. And so another one is like glands. So if we damage the thyroid gland and then we electrically stimulate the vagus nerve, little branch that goes to the thyroid, then that thyroid heals in a much, much, much faster rate. And it may be the determining factor. So the nervous system plays a key role in the repair of structures. And so if we've got things where are damaging the nervous system, it's unable to do so. So the toxins can be a neurological blockade, you could say, and also a healing block. And that's one of the main reasons. I mean, it may not be the only reason, obviously, but it's certainly a main reason. And when we're getting more and more into the field of the energy of the human being, the nervous system and the electricity and the energy and the light systems that seem to be so critical in our bodies to maintain health, then I don't see how you can put anything other than the nervous system on top of that as the leading kind of instigator of change in the body and the receiver of all this information, whether it be any kind of energy. And I think that's why in certain circumstances you can then lean on a different idea. Like you can pretty much utilize German new medicine in most situations. And I think the only caveat to that, and something that maybe Dr. Harmer did think of, but didn't necessarily elucidate, is that when the vagus nerve or other nerves of a similar value, there are others that act similarly in the system, mainly glossopharyngeal and trigeminal nerves. They are almost similar to the vagus nerve in the whole grand scheme. When they get damaged from toxin exposure or radiation, they no longer have the ability to function optimally or at all, and they may behave in one of two ways. They may behave in an aberrant or compensatory way that means it becomes hyperactive. And there's numerous models of demonstrating this and it's well accepted. And I don't think that it's like germs in this way. Hyperactive behavior of nerves is well accepted because we can see it, we can test it. Somebody feels more sensitivity in that nerve when it's been damaged, and their muscle tone goes up. So everything's in an elevated state, and that's one manifestation. And it does mean that in some ways you might see an organ of the vagal innervations become hyperactive under toxin exposure. So, for example, you might see the heart rate go right down. And we might say in the terrain paradigm that everything has a reason, okay? But I think that in some circumstances like this and others which I'll mention, the terrain paradigm can't be utilized in the same way. It is, and this doesn't go against terrain at all, it's just to add to the understanding. If a toxin damages the vagus nerve, we have a very different situation, okay? We have a situation where the body will try to repair it, but in the meantime, we've got some symptoms that are problematic, which are not in any way useful to us, okay? Bradycardia, really low heart rate, actually doesn't help with the healing rate. That it's not helpful in many cases, and it may kill us. People can die from vagus nerve damage. They can. It's not common, and it does tend to be iatrogenic. Yeah. Like you can overstimulate the vagus nerve during intubation. And when you do that, you can lower the heart rate so much that they die. And that's not the only way you can do it. And I think that that's something to consider. Obviously, that's that fits into the terrain paradigm because we're intervening. And so we kill ourselves in that way. But coming back to all the ways that which the nerve can become hyperactive, gut motility, for example, diarrhea, right? This is a hyperactive activity of the vagus nerve, constipation being underactive. And we would say normally diarrhea is a detoxification mechanism. And in this situation, it would help because damage to the vagus nerve actually, when it goes hyperactive, into a hyperactive state, it will create diarrhea. And it would also do that to detoxify. And in this circumstance, this is appropriate in both situations. It's not an aberrant, like, say, low heart rate, which can kill you. Diarrhea, as long as we maintain our hydration, won't kill us. And so that's a good example of aberrant behavior that isn't really aberrant, quote unquote aberrant. And there are other situations like this. In certain circumstances, the hyperactivity can be bad. In certain circumstances, hyperactivity can be good. And then after a while, if the damage is big enough or long-term enough to damage the nerve to the point where it can no longer behave in a hyperactive state, which can only really occur in low damage states, it will actually become underactive. And this is a situation where, if look at German new medicine, they'll say that the initial phase of the trauma is an underactive vagal state. In other words, it's a sympathetic state. It's a stress state. And they're not symptomatic during this time. And I'm looking to kind of investigate what is the role of the vagus nerve in this situation. We do have this tendency towards thinking of the vagus nerve as something we want to have active all the time, but that's really not the case. And it's not as simple to say that the vagus nerve is active in all areas of the body at all times. When it is, it can be active at the same time as the sympathetic nervous system. And it can be active in the gut and not in the lungs, and active in the gut and not in the heart. So it gets a bit more complicated and it's not so clear anymore, And unfortunately, people will say it's black and white, but it's completely and utterly many, many shades of grey. So it's not really clear. So my add on to that, sorry to go around in circles though, feels that way, is that it's likely that the main thing that we need to do during the process that is German new medicine's going through the initial phase of the shock, then the phase of the healing, which is the second phase, the vagotonic phase. You can look this up online. There are numerous sources about how German new medicine works. And if you don't understand what I'm talking about, read that first and then listen, because then it will make more sense. We don't want to spend an hour talking about just German new medicine. You've had guests on about that. And during this phase, or both phases, it's likely that the general health of the autonomic nervous system is important. So it's also important to understand that in many cases of vagal damage, there is sympathetic nervous system damage too, and that also the preceding factors to vagus nerve compression, which is something we haven't mentioned yet, can also compress the sympathetic nerves as well. They're not far away. And they also can compress the nerve that goes to the diaphragm, which will alter the breathing patterns of people, which may have come up in other lectures you've done. So a lot of people conflate them and misunderstand that it's the general health of the autonomic nervous system that matters. It's not like sympathetic nervous system bad, vagus nerve good. It's more that both need to be able to function optimally. And many people who present to me and they say my vagus nerve is shot actually have low sympathetic nervous system activity too, or it's actually been misrepresented as vagal. And so that's what I think we need to consider, is that the entire autonomic nervous system needs to be repaired sometimes before any of these two phases can go through full to their endpoint and achieve their goals. So that might be one of the kinks in the armor of the person. The they might be that they have got a damage to their autonomic nervous system and they cannot go through each phase fully. And that might be due to toxin exposure preceding it or during it. So that's probably where I would put it. I mean, it's complicated. But I do think it comes back to toxins. I do think we need to consider toxins more. At this stage, that's what I think. And that might change, like all science, all changes based on the evidence. But I don't think we can leave behind some of these toxins. I think that they damage the nervous system and then they leave us high and dry for us to in our ability to detoxify. So as soon as the vagus nerve gets damaged by these toxins, which it does, I see it clinically, I see it in clinical testing, and I'll explain how that can work. And then what happens is we aren't able to detect them at the same rate because the vagus nerve is the primary detection system of toxins in the gastrointestinal system, in the respiratory system, in the throat, along with glossopharyngeal and trigeminal nerve. And if we don't detect it, we can't then initiate an elimination pathway.
Yeah.
Sorry, I went on for ages there.
No, that was that was great, and yeah, probably a lot to take in for the listener, but I think they can hang on to that. I'm sure. I think it's really interesting the points that you brought up, like negating. We don't necessarily need to negate the physical. Like, there's a certain amount of information that we can learn from the physical. We had a fella on, Paul Leendurst, and he mentioned how cancer actually manifests as a fungus. How it's actually the body rotting out, and he um, was a little bit critical of the mechanisms and almost philosophy of German new medicine, although, you know, his root cause of cancer was psycho-emotional, always, 100% of the time, and this seems to be a recurring topic that these traumatic events or these conflicts, and to explain it in as the Bigelson brothers would, that there's this scarring in the body that allows for us to hold on to these toxins, so the body can't store and hold on to these toxins without having that psychological damage, having this damage in this respect. And so I think you had an interesting piece to the puzzle that there may be direct nervous damage inhibiting this healing process. And, perhaps I'm kind of just tying in a few episodes here, but, perhaps the nervous system is almost acting as this microcosm of the body, right? Whereas it's being stored in the nervous system, so the nervous system can hold on to these toxins as well, um, which in turn is hurting the organ in question or whatever it may, the tissue, allowing the tissue to hold on to these toxins as well. And, it's interesting because if we lived in a world free of toxins, it wouldn't necessarily get rid of the problem. We might not see, stage 4 cancer.
Mm.
It may be, less deadly, right? I know we're questioning that a little bit here, but because our bodies do produce a certain amount of toxins just in our general metabolism, that perhaps we can hold on to with this psycho-emotional damage as well. So, but there is an
Yeah.
interesting case that, that we're inundated with these neurotoxins, like these heavy metals, these MSGs, like the aspartames, all of these different toxins that are known neurotoxins, right? We're plagued with them, and we're plagued with our neurotoxic phones, the dopamine constantly hitting us all
Yeah.
the time. So it's certainly inhibiting our nervous system's ability. And maybe that is the direct infraction. Maybe that is the infraction on the nervous system that is inhibiting our healing
Look,
mechanism.
there's a few things to discuss there. One is the use of things that seem to enhance our dopamine activity, right? In the literature, you can see that when you electrically stimulate the vagus nerve, your dopamine neurons fire at a much, much faster rate. Okay, the same for serotonin and noradrenaline, all of which are neuromodulating type neurotransmitters. They go to majority of the brain, but in particular interest is the frontal lobe, and they essentially switch on the frontal lobe. Obviously, dopamine has more functions than that are specific to dopamine, and I do wonder whether someone who constantly goes to the phone to feel a sense of dopamine or a sense of anticipation of something, that's how dopamine works. It's the anticipation more than the actual getting of the thing that is enhancing dopamine activity. Whether that's just a little bit like using cigarettes to enhance vagal tone, because that's what cigarettes do. They give a sort of partial, small amount of vagal activity because of the nicotine. And it's like self-care, it's self-treating this low vagal situation, because low vagal tone does tend to be represented in the brain as low dopamine activity and low serotonin often as well. And does depend on the situation. And sometimes it's appropriate, sometimes it's inappropriate, just like we said about the heart and the gut. Now, I do think that the missing piece with a lot of these discussions, and I would say that it's my bias, I love the vagus nerve, but I do think that because people don't really have a clear neuroscience background, they don't understand the degree of which the vagus nerve is present in the toxin interface with the body. Like in one way it's good and one way it's bad. One way it's good because the system is able to communicate better amongst one nerve group, right? And it's more efficient. Whether we believe that the nervous system is one structure or a group of nerves, either way, they're closely linked. When that nerve group gets damaged, you do have a higher proliferation of bacteria and fungi, more than likely fungi, but that's not always tested in a lot of these research papers. But the bacteria becomes quite prevalent towards pathogenic. But pathogenic is not how I look at it. So, for example, I think we mentioned this last time, most of these so-called bad bacteria that proliferate in high numbers once the vagus nerve is damaged. You see it in vagotomy when they cut the vagus nerve studies, which they used to do for reflux. You see it in when they actually damage the vagus nerve, and you see it in cases of head trauma where the brainstem has been damaged, the vagus nerve as a result. You see that the gut microbiome goes towards pathogenic. When I say that, I mean, opportunistic bacteria go higher in levels, and things like Klebsiella, Citrobacter, Vibrio in certain circumstances, all sorts of things go elevated. And you'll see this on people's stool samples. They'll have, all sorts of symptoms, and they'll see that their gut microbiome is towards pathogenic. And they'll say, well, that's why you've got the symptoms. No, and it may not be because of vagus nerve damage, mind you. Okay, but I think what occurs is when the vagus nerve gets damaged by the toxins, the body goes, or by a trauma, the body goes, we don't have the same system available to us to selectively eliminate, because the vagus nerve produces mucus. We can eliminate toxins that way. We can capture them and eliminate them through diarrhea that way. And if the vagus nerve is damaged, we can't necessarily go through full diarrhea responses in the same way. Although there are some local mechanisms for this, it may be the case that the body goes, screw it, we're going to go full pathogenic bacteria because these bacteria are the best at dealing with these toxins. And that's the truth. There is so much more ability for these bad bacteria, quote unquote, bad bacteria, these heavy duty militaristic bacteria. They're way more able to bioremediate and transform or eliminate or sequester these heavy metals and other toxins, including plastics, than your lactobacillus or bifidobacteria. These aren't able to do that so well. Although they have a role to play in that picture, that's why they don't completely go. You see the shift for a reason, and nothing is done for no reason. This is not done for some random reason, like the body is now pathogenic and we must kill these bacteria to cure them. That's not how this works, in my opinion. So the body is trying to get out of the situation it's in, and that's why these fungi, candida overgrowth occurs. Then you'll see bacteria overgrowth and bacterial networks that wouldn't normally be there suddenly emerge, and that would be the pleomorphic effect. Or they were hiding in biofilms, which is fine as far as I'm concerned. Everyone goes on about biofilms. They look at it in the wrong way. They really do think that. And then enter H. pylori, Helicobacter pylori. And one of the reasons I think that emerges is to deal with the damage that has occurred to the stomach lining. I think that it's an actual stomach lining reparative organism. I don't think it causes the disease itself, obviously. It's so easy to point the finger at the wrong thing. If it's present in high amounts, it's always that fireman at the fire principle. Like nearly all of these, not one of these situations has been created in an experimental model or an experimental human versus control. So no one's been given these things and had a control and then seen that it causes disease relative to the control. I mean, they just haven't. And even if it causes diarrhea, why is that bad? Like this is the problem. We've misrepresented symptoms. So, bacteria, and it might be the case that a lot of people get confused and a bit sort of distracted by the fact that fungi are in high numbers. And we'll say that it's what cancer really is. But, German New Medicine says that fungi, and particularly bacteria, are needed to kind of degrade the tumor. And so they'll go really proliferate, and they'll probably say they've got an infection. And then they'll give them antibiotics, and then maybe they'll die as a result of that, because we're getting in the way of the bacteria's real role, and that's to eliminate the tumors, or that might be the fungus's role, although that tends to not be how it's described in German New Medicine, from my understanding. That's more in the repair of structures. So I'm not sure. I don't think that the way you've mentioned it, the way other guests have talked about it, I personally don't see it that way, because it's not clear. It's not very clear, and it's not based on very, very clear evidence other than experiences. And so we can create any idea out of our own experiences because we don't really know what's doing it. But I do think they're in the right direction. Yeah. But I think we can explain it through the vagus nerve. I do think that that's probably, I would say, the missing piece of the puzzle in this terrain paradigm. That's what I push, at least. And that, you can have changes in the brain that are in some ways not ideal for the organism, and that's due to vagus nerve damage too. So it doesn't always have to have meaning behind it. Yeah. I think we can get caught up in ideologies where we're rejecting one. We're rejecting germ theory, and I certainly reject autoimmunity. I don't believe that is a real thing. That's not what's causing that condition. And certainly inflammation as a cause of disease. This is trash science. There is nothing about it that is logical. And possibly cancer, as far as German medicine is concerned, because I think that's the best explanation. As we're going through this, do we reject everything and start afresh? I don't think that's the logical way to do this. I think we need to peel back the layers one by one and see which ones remain. And at this point, the nervous system is, I think, absolutely critical, particularly the autonomic nervous system, which is also known as the survival component of the nervous system. Without the autonomic nervous system, we literally die. And so it is the thing that keeps us alive through our vital organs, through our central nervous system regulation, and cognitive components or cerebral. And if we don't include that, we basically don't get to the answer. That's my opinion.
Mm-hmm. Awesome. Yeah, and so I'm feeling compelled. I was having a conversation with a guy there a couple days ago and about German New Medicine. And, he was taken back a little bit that, I was looking into German New Medicine when we were talking a lot about logic on Instagram and scientific method. Um,
I know where
how
you're
would
going.
you approach that sort of situation? Because to be quite honest, I don't know evidence for German new medicine enough to be able to criticize it in that respect. But you seem to have a great understanding of it. So how do you approach that? Would we approach
I think there is
knowing
good
German
evidence.
medicine?
No, I think the
Yeah.
CT scan representations of the body, these sort of so-called not necessarily disease lesions, but like visible changes in the brain at particular areas of the brain that correspond to particular areas of the body. This is what we
Mhm.
need. This is replicable. And he's shown in his studies using CT scans that it is replicable, you know,
Mhm.
and we're looking for markers. And that's what we do in medicine. We look for biological markers of disease. Okay, well, at least that's a fingerprint or some kind of representation of it in the brain. And most certainly, I think Dr. Hum would say that the brain is a representation of the body,
Yeah.
and the body is in some ways manifesting something that's going on in the brain, you know. And we just look at it in a different way. This is the problem. We have a lens, and because we have that lens, everything else seems to be absolutely impossible. Because we do have blinkers on. We have no comprehension that the brain could manifest something like a tumor in the body because we don't understand how it does that. But that doesn't mean it doesn't do that, you know. And we also, with understanding tumors, you know, we think of them as something that emerges from senescence, or you know, things that promote senescence, and then without, you know, the ability for our body to kill off that, it just manifests into tumors. Well, it may be the case that all of that is misrepresented. You know, that a lot of this behavior in those cells is actually what's going on in the brain. And, you know, there's plenty of that in vagus nerve world. Like, people misrepresent the vagus nerve every day. They misunderstand it. And it's not like they have any reason to. The science is there. It's just that they ignore the neuroscience of the vagus nerve. They'd rather treat it like this ethereal thing, which it's not. It's far more interesting than that. And this in this case of the, say, German new medicine, there's the real unwillingness by people to want to investigate it further, even though, like, he has shown that there are lesions in the brain in specific places that are replicable, meaning if it's this organ that's affected, then it's this part of the brain, and it's consistently shown in that one part of the brain. That has meaning. And we may not have all the pieces yet, but we if we don't investigate it further, then we're not going to get to the point where we understand it. We're just going to throw it in the trash, which I think would be very devastating for humanity. And the problem also is that he's dealing with oncology, and oncologists are not experts in the nervous system. And this is a big issue. Not that an oncologist would want to talk about it in this way, because that would go against everything they've been taught. And the other problem is that using German medicine is that you're likely to have issues with government and law because of the big role that big pharma has with cancer. Anyone trying to say they're going to cure cancer, and I've never made that representation of that, but anyone who is saying they can cure cancer is liable.
Yeah.
And so we've seen that time and time again. Anyone who's tried to cure cancer or said they could got done. They done them in, you know, and that's why everyone's a bit careful with this topic, you know, because no one really cares if you say you can cure Hashimoto's disease. No one really cares, you know. That's not, obviously it matters, but no one's going to knock on your door and say, you know, you're being arrested for false information or for whatever reason they might say.
Yeah.
Um, and so I think that's where it goes a bit wrong for people, and that's why it's a contentious subject. But it can be talked about. I think at an academic level, we need to consider it. At least when the safer area to talk about is the role of higher order brain systems and how it can manifest in conditions of degeneration and where tissues have declined, say osteoporosis, for example, or arthritis. And so he has good explanations for that. They're of the new brain, not the old brain, things like that. And it's interesting because we've got studies now that show vagus nerve stimulation increases the cartilage and repair rates of joints and osteoporosis to some extent. There are all new studies. They're not fully into RCT trials yet, but that's interesting. I think that if we understand the vagus nerve more and more, we'll understand that it's a key component of the repair process, and that goes with German medicine when they say the vagotonic stage is the repair stage. And if we don't have adequate vagus nerve activity during that stage, it could be the case, I hypothesize, that it doesn't adequately go through that phase or it's stalled. That could be the case. And that might be where I step in and say, look, here's what I know about the vagus nerve, and here's how you can really ramp up its activity and deal with why it's damaged in the first place. Yeah.
Yeah. Yeah, I've recorded a really interesting conversation yesterday, and that would be last week's episode, I guess,
Oh, yeah.
when it goes up, with Dr. Sophie Fletcher. And we were talking about, how the individual's experience can lead to, it can manifest in different ways. Of course, physically, biologically, the nervous system always comes up. A big thing that we were talking about in the healing phase was the somatic component, right? Movement as
Yep.
as healing these emotional traumas, healing these psychological traumas, and not necessarily, she takes a really interesting stance actually that, you know, it's not really about going back and reliving these traumatic events, but more so dealing with them in the here and now. How are our behaviors maladaptive now? How are our habits maladaptive, right? Um, and I think this is really interesting perspective, but the component of movement is something that everybody brings up. Um,
Yep.
and so I'd love to hear your thoughts on that, especially relating to the vagal nerve, vagal stimulation. Is there a somatic component to that there too in the healing process? Can that help expand on the healing, right? I feel
Oh,
like
look,
moving
movement
and
is key.
even,
Movement is like a
yeah.
non-negotiable. And I have like a list I put up online recently about non-negotiables. Before implementing any kind of treatment, you need these in place in order for the treatment to work properly or adequately, and have no expectations that it will work until they're there. So, and then if you don't have these non-negotiables in place, then the clinician's job is to get you there first, and then we'll get on to. And that may look very similar, but the point of it is more of an academic thing. You don't. If someone is sedentary and they sit down all day because of their pain, or for whatever reason, they might have chronic fatigue. But you've got to deal with that as part of it. You're not going to see healing in someone who doesn't move. I think that's pretty obvious. And that's not only because of blood
Agreed.
flow, and it is to do with blood flow. This is why someone gets up in the morning when they've got pain getting out of bed and they move around, all of a sudden that pain slowly goes away. A lot of that is just blood flow. And maybe that's to do with structured water. Maybe that's to do with how much destructuring occurs in certain nerves, and that results in pain maybe, and moving around restructures water, something like that. It could be the reason. We just know that movement is key. And one of the problems in the field, and you might have noticed this, is that people talk about aberrant movement, or they'll say movement that is incorrect. Like it's done in an incorrect way. The problem is there's no evidence that any movement pattern is incorrect. Like, for example, bending and picking up objects by the waist versus the hips. Okay. There is actually very little evidence that waist-based flexion, so lumbar flexion, lifting, is any more dangerous than hip flexion lifting. In fact, people who were told in a study. It was a study done. I can't remember the author. It was years ago that I read it. People were given two main ways of which they could lift boxes in this study, and they were heavy. One was they squat down, straight back, and lifted. The other group could just do whatever, bend from the waist, whatever they felt. The one that bent from the waist had far less problems. Less pain, less discomfort, less complaints. And this goes to the fact that everyone has a different way of doing things. And the problem is we've set all these guidelines. There's all these people making a lot of money teaching different movement patterns and fixing your movement. And definitely people have weakness, right? But movement behavior, the way you move, doesn't necessarily tell you anything about the problem. And this is, and a lot of people hate this when I say this, because the evidence does not back up their claims. For example, if you lift your arm and your scapula at the back, the scapula does a winging action. If it does that, that's bad. You must have scapular dyskinesis, which is essentially a movement aberration, abnormal movement, and you're going to fix that to get rid of that shoulder pain. And that's absolute garbage science. It's not true. The likelihood is that you'll see these things. Any movement pattern you see in someone, and I know this is not what you were referring to, but I want this to be clear to some people because it's just out there all the time with somatics. People move in a way that is best suited to them at that time. And that doesn't mean it's bad. And if someone does a movement, right, let's say they walk and they roll their arches and all sorts of things, and that's bad for their Achilles or their plantar fascia and all this. Don't worry about it. The fact is they're moving. Like, that's all that matters. All that matters is people move. And sometimes people will say, well, their abnormal movement patterns are stopping them from doing more, or that's what's causing their problem. No, it's nearly always nothing to do with that. It's nearly always to do with the lack of movement. And, this is the problem. Like, people create barriers to more movement by creating rules. There are no rules to movement.
Amazing.
So, that's my opinion. After years of doing it the other way, I've had to unlearn. And there's in terrain, we've unlearned germ theory. Well, in my world that I started in, which is in musculoskeletal health, we had to unlearn a lot of these ideas. One of them was that tissue types cause different pains, muscle pain versus bone pain versus joint pain and all this. But they're all nerve pain. Without the nerves, you don't have pain. So let's get over that and let's just move on. And then movement. You've got abnormal movement. We assess movement for hours and then try to fix that aberrant movement pattern. And somehow that's going to fix their problem. Well, it might by chance, but the truth is that when it's studied, it just doesn't stack up. Like, those movement patterns are seen in healthy people and unhealthy, meaning people with pain and no pain. And those don't necessarily, and correcting them doesn't necessarily result in any change in the pain. Treating the pain, people's pain, helps them move more, getting them out of that phase. We go back to German new medicine. If people are in pain, they're in a healing phase. Pain is a suggestion that they're healing because the same chemicals that promote pain are also, by and large, vasodilators. So, they are a big part of kind of reparative response, and we get in the way. It's interesting. A lot of my therapies, people say, is this work on inflammation? I say, well, technically it's pro-inflammatory therapy. So everything I do that is essentially pro-inflammatory. You put a needle into someone, it's inflammatory. Acupuncture and dry needling is inflammatory. When you use shockwave therapy, everyone knows I use shockwave therapy. Shockwave is inflammatory. Even low-level laser and light therapy is actually inflammatory. So, people think, red light's anti-inflammatory. Well, that's a very narrow-minded way of explaining it, because a net effect is anti-inflammatory, but initially it's pro-inflammatory. Okay? And this is good. This is not bad, right? So that's where I come into it. I think people need to move, and we're going around in circles, sorry again, but we need to get people to move. We need to get them repairing, and movement is a key part of that. If you don't load tissue, they don't think they need to repair. right? If you don't walk and load bear, you're not going to change your osteoporosis. If you don't load bear, you're not going to change your osteoarthritis. Osteoarthritis is more associated with sedentary behavior than it is with movement. Okay. That is completely misunderstood, and it's well established in the literature now. And they'll say, the new caveat is this, they'll say, well, actually, it's more to do with the level of interleukin-1 beta. That's probably more indicative of what osteoarthritis causes osteoarthritis. And that could be obesity causing it, diet, lifestyle. And I'm like, look, it just suggests they're repairing. That's all that means. And interleukin-1 beta is a pro-inflammatory cytokine that everyone should know about. But what it really just means is the body is initiating a repair response or some kind of debris removal, which it may well do depending on the phase it's in. But anything where the tissues have declined, tendinopathy, or like I've already mentioned, osteoarthritis, you've got to stimulate the tissue to get repair in the tissue. So if we're going to repair people's nervous systems, coming back to that, you have to use your nervous system, okay? And there's nothing more engaging for the nervous system than exercise.
Amazing. Yeah. Yeah, I couldn't agree more. Yeah, I bet it's about moving more. That's what people
Yeah,
need to do, right?
yeah.
We live so sedentary
Doesn't matter what
lifestyles.
kind of movement it is, just do it. Don't create rules. Everyone's like, oh yeah, I meant to do X amount of these exercises, and or I really should be going out there and doing this, and lifting weights. And I'm like, yeah, but can you walk? Is there a reason why you're not going for a walk right now? So
I
you don't create rules for people. Yeah.
No, I think that's a really important point, especially as people working as practitioners, right? Trying to help
Mm.
people heal. Trying to create these rules is just gonna well, I'm reluctant to follow rules. If somebody tells me that I got to follow a rule, I want to break that rule even more. Right? So maybe that's just
Yeah.
the
Yeah.
Dunning-Kruger
Psychology
there.
of it, isn't it? Mm.
Um, yeah, I think that's a really, really great point. And even on the topic of German new medicine a little bit, we're talking about adaptation too, right? So say you do say you have a condition like you were mentioning, osteoarthritis or osteoporosis, you know, your body is going to try and heal that. But like you said, if you're not moving, the body's not going to adapt to a moving body, right? The body's only going to heal
Yeah,
enough. It's going to keep itself alive enough to function, to sit on a couch or whatever it may be, right? So
that's
if you're not
exactly
getting
right.
out there moving, it's not going to adapt to what you want. And same as healing injuries, I'm sure. Like if you tear
Hmm.
your Achilles, you want to make sure that you're starting movement as soon as possible, right? Obviously, working
Yeah,
pretty light. I don't know if
that's right.
you kind of apply that the same way there.
I find the best way to deal with the majority of injuries is just to commence moving it as soon as possible. And I have no interest in ice. I have no interest in immobilization. There are circumstances where that's not appropriate, like your leg is split in two, or you've got some pretty insane injury to a bone where it's coming out of the skin. It needs surgery, and that does need surgery. Um, but they're really the only examples where it doesn't apply. Like if you just sprain your ankle, the last thing you want to do is wrap it up in something and then go and put it up and put ice pack on it. That is literally the last thing you want. And that is an old idea that has not completely been eliminated, but many, many people don't believe in that anymore. Many people will say the best thing to do is to keep moving,
Yeah.
and to keep walking. And I sprained my ankle. This is just an anecdote, but I sprained my ankle about a year ago, and it was all swollen. And I was like, "Screw this!" And I went for a 30-minute walk, and it hurt the entire time. And I just I limped through it, and did some other things where I pretended my other leg was injured, and this is a little psychological trick. Listened to music, had a coffee, went for lunch, and then I came back, and then this is what I was. I'm also a choreographer in ballet, so I did it during that. What a surprise! I'm too old for ballet. But then I was just sitting there, and I realized this is after half an hour later, after half an hour after it realized it was really getting swollen. It was sore for a good hour prior to that. Went for that walk, came back. Not 30 minutes later, I realized I don't have any pain. And I know a sprained ankle when I see one. This was at least a grade 2. But how am I pain free now? I don't understand. Um, there's a bit of a longer explanation as to why a lot of people recover so quickly from sprains when they walk. We don't have to go into that, but the point of it is that we need to listen to our bodies need to move, right? And unfortunately, we've been trained to think, to wrap it up and hold it up in the air and do all these things, because that's the fear that drives that. It's not natural to do that. It's natural to keep moving and keep the blood flowing, right? Because if we do that, we actually really halt healing. Ice is a great way to stop a healing response. It really does lower blood supply to the area. That's why they use it, right? To stop bleeding internally. But the problem is that you're also suppressing a bunch of other things. You're actually also suppressing nerve activity. And there's a large study that was done, I think it was published in the British Journal of Sports Medicine, and they said that there is a real problem with ankle sprain icing because there is a considerable number of these people that are getting fibular nerve damage from it, because it gets placed over a nerve, and then later they're like, oh, I've got all these nerve problems. So the treatment, which really isn't effective, is actually worse than the injury itself long term, because nerve damage is far more problematic than ligamentous in most cases.
Hmm. Well, because it's going to inhibit that healing, right?
Yes, well, the loss of nerve activity. We went back to that before. Like, people don't appreciate how much nerves do. Nerves release inflammatory chemicals as well, and nerves release a lot of other substances that we just haven't really discovered yet. It's very new science. So the nerves are very much endocrine structures.
Hmm. Love it.
Hmm.
I think we could probably tie it into the osteopath's work with moving the cerebral spinal fluid through movement and even through
Mm-hmm.
body work, and the healing components of that, right? Because they're talking about a whole other breathing mechanism of the body through this, the
Mm.
cranial sacral connection and the movement of the cerebral spinal fluid. So, how do you connect that in?
So this kind of craniosacral approach is quite widespread, even in chiropractic, which I trained in. Um, how much of the movement in the therapies does it, or versus just walking? Because walking,
Mhm.
everyone places a lot of, particularly in chiropractic, they place a lot on the alignment of the spine as being important to this. And that may be true in many circumstances, particularly upper cervical spine. I think it gets less and less important as you go down, personally, in my experience, but because the space is greater. But and the degree of the nervous system in the spinal cord is getting less and less. Um, but I think the movement is important in that we have natural movements that do this. For example, like I said, walking. Walking undulates the spine, creates pressure gradients as going up and down the spine, and creates change there. And I think one of the interesting things that comes back to this, which seems unrelated, but is the role of cervical stability, and the fact that a lot of people are actually really weak in their neck. This is probably the biggest problem I see. And this leads to vagus nerve disruption, sympathetic nervous system disruption. And it also leads to malalignment syndromes in the neck that occur at a much faster rate and may be alleviated by manipulation or soft tissue releases and all sorts of things, but are not maintained that way. The only way you can maintain alignment is through adequate strength and good nervous system activity, because strength is only garnered by good neural activity to that muscle, right? Um, so they might well say that alignment of the C1, C2, which is probably the most important one in chiropractic, maybe osteopathy to a certain extent. I think it depends on the osteopath. Um, takes a key role in manifesting all these different downstream symptoms. So If you, and this goes to cerebrospinal fluid, because a lot of the cerebrospinal fluid is getting sort of stuck there and around the upper cervical region. And my belief is the reason why treatment of the upper neck and mid cervical spine as well results in systemic change, including the brain. Function of the cerebrospinal fluid is likely a component of that. One of the things that really does matter is the role of how the nervous system interacts with muscles, meaning the more electrical activity you have in the neck to the muscles, and the more muscle you have, the better it is at regulating the stability of the neck and the ability to flow freely the cerebrospinal fluid into the brain from the spinal canal. And I think that's probably the best way I would explain it. And I've seen great results with neck rehabilitation exercises, things that you wouldn't expect. We already know that neck massage increases digestive activity. That's been studied, and that's interesting by itself, particularly the muscle, the sternocleidomastoid. If you release that muscle, you, by and large, will increase digestive activity because you decompress the vagus nerve. The sternocleidomastoid is the main muscle that would compress the vagus nerve in the neck because it crosses it. And when your sternocleidomastoid gets really overactive, it could be one of two reasons. One, the needs of the neck mean that we need more activity in that muscle. So it might be weak. So muscles get tight when things are weak, and it allows them to be a bit more efficient when they're in a higher tone state. And then the other reason might be that the nerve that goes there is damaged or is entrapped, and that's the spinal accessory nerve. And people often complain of tightness in these two muscles, the muscle here, the sternocleidomastoid, and the muscle on top of their shoulder, the trapezius, and they're both innervated by this spinal accessory nerve. And this spinal accessory nerve, funny enough, sits right next to the vagus nerve in the upper cervical region and can be entrapped here along with the vagus nerve. And so all of a sudden it becomes this big circle. You're going to go, where does it start and where does it end? And it could be the case, and I believe so, that the general stability of the neck is a big player. And why have we got so many people with stability problems in their neck? I think one of the reasons is that we don't behave in the way that we used to. For example, we would be on the ground and we would constantly have to hold our head up in a way that was different to the way we do now. This is one theory I have, and it may not explain every situation, right? And there may be chemical reasons for this as well, which I'll go into. But we don't really challenge our neck the way we used to. That's all I mean, in the way that we move, because we sit down like this and the neck is not challenged because gravity just stacks the bones. So every other situation where our neck would be challenged would be getting up and down from the ground because we're having to lie down and get up, and we use our muscles. And for many years, everyone avoided using their neck muscles, but that is actually quite detrimental. It's far better to be strengthening your neck to protect it than to avoid activity in the neck. They used to do this: hold your head when you do sit-ups, otherwise you'll hurt your neck. Well, you'll strain it because it's weak. That's why. But the chemical cause, it could be things that are estrogenic. So estrogenic compounds are definitely linked to hypermobility syndromes. So it could be the case that more and more people are getting these changes in movement patterns in their neck because they're becoming more hypermobile because of an estrogenic xenoestrogens. And that might be one of the reasons. And we're certainly seeing that with gender. So I wouldn't be surprised that physical manifestations of these compounds that are estrogenic would be present. So that would lead to the neck being more unstable and the sacroiliac joints being more unstable. Again, goes to sacro-occipital ideology. These two bones, if the sacroiliac joint is unstable, that is not good for the person because it needs to be inherently stable for the functioning of the hips and lower back. And if the upper cervical and mid-cervical are not stable, although they're already unstable to begin with, then you're going to get problems too. And that's what we've been referring to. So I do think it's possible that we're dealing with a toxicity problem as an origin.
Hmm.
And that could be phthalates. So not sure.
Yeah, very
Yeah.
interesting. Yeah, well, a note on the, the natural movement to get this cerebral spinal fluid moving too, right? They do a lot of cranial osteopathy is something I've
Yes.
done, and something I've heard people speak of. Chewing is a great way to stimulate the movement of the skull. Now,
Yes. 100%.
um, yeah, and this is really important, and I think I think it can be inhibited by poor facial structure. If you don't have a proper bite pattern, you're not going to have the right pressure on every tooth, right? So I think that can be problematic. But I kind of play around with my dog sometimes, and when he's chewing on something, I'll feel his head. His whole head, you can feel, is in motion, like on the very
Yeah.
top, on the back, everywhere, his neck,
Yeah.
everything. And I just think that's a really interesting observation. It's more discrete on humans. We have a much bigger skull, obviously, than dogs,
Yeah.
but um, these mechanisms are homogeneous, or they're the same across the board. And I think that's really important. And I'm glad you brought the neck thing up. One of my buddies gave me some wisdom one day, and he told me that the neck is the only muscle that you can see when you're wearing a shirt. So you better train that muscle. So yes,
Yeah.
it's the only one you can show off all the time. So I thought, oh, that's a little motivation for all the listeners out there. Training neck is great, and I love to hear the health reasons behind it. That's a really, really amazing thing that I haven't really heard of before. I mean, I saw you post about it, but
Yeah, well, you mentioned the jaw, right? Well, there are numerous reasons why people might avoid overuse of the jaw. Or not overuse, but more use than usual, right? So they avoid certain foods and things like that. It might be two, three reasons or for whatever reason. But one is that mechanically it does really get tight when you have some kind of entrapment of the trigeminal nerve, which is the nerve that goes to those jaw muscles. And it might also be mechanical because the stabilizational base, which is the cranium, is not stable on the neck. So a lot of the reasons why people get tight jaws is because they're weak necks, and you got to look down the line, right? So, well, okay, so the jaw, the mandible is attached to the cranium. Well, what's the cranium attached to? And so if there's a chain in, a link in the chain that's in some ways not stabilized, then that's one way of looking at it. But I also think that it's to do with the way we're brought up. We're given soft foods from an early age. We're not given whole foods. Like with my daughter, I did a thing called baby-led weaning, which you give them basically whole foods. Her first food was a lamb cutlet, and she would just like gnaw at it. She didn't have any teeth, but she'd just like use her jaw on it, and she would suck the blood out. How caveman of her! But it was an approach that we took because we saw the evidence, and it made sense because it was kind of how historically we would do things. We didn't have a blender. We didn't go and blend food just so that the baby could eat it, not 1,000 years ago. So like, what did we do? And why have we lost a lot of this jaw activity? Why have we changed our jaw structure so much? Well, we don't chew. We just don't spend a lot of time chewing. And this actually leads on to another thing. Sorry to take another path, but in my talk, which I do, which is called Fix Your Gut, it's just a talk I do to the general public. One of the things that I explain to people is if you do not chew enough, you will not stimulate your vagus nerve. So chewing is a stimulation of the vagus nerve because the trigeminal nerve is like a very important first point of contact with food. And the trigeminal nerve is very active during chewing, and not just the trigeminal nerve, but a lot of nerves. And they're constantly communicating with the vagus nerve saying, food's incoming, food's incoming. And the more you chew, the more neural activity there is. And so the more acid secretion you'll get. So if you're eating a bit of steak or anything, you got to really chew it to the point where it becomes, a paste liquid almost. And then you can swallow it, and you're essentially doing everything you need to. But a lot of people do, and I'm guilty of this as well. We rush our food, and that goes back to how we eat. We eat on the run. and we don't eat things in a way that we used to, or that the blue zones do. They eat in communal, like they together. It's a slower process. Or in France, it's 2 hours for lunch, something like that. And then I think that's important. I think if we were to take more time with our food, we would have better absorption of nutrients, better gut behaviors, things like that. We wouldn't strain our system so much, but we do. And I think that's why the jaw activity is important. But if we're avoiding it, there are other reasons we might look at. Yeah, avoiding jaw movements.
Yeah. Yeah, something I learned from John Rose, who was one of the first guys I started learning about this terrain model. He's this
Oh, yeah.
guy on YouTube. He's actually been raw vegan for like a very long time, which is interesting. Like
Yeah.
he's in his 60s now, and um, he's seemingly in great shape, high energy, eats like only raw vegetables. Really interesting guy. Used to be a pro tennis player.
Okay.
Not that I agree with the vegan approach, but you know, he's got some wisdom, that's for sure. And he talked about uh, you should chew every food until it becomes a juice. That was his philosophy. If you're going to eat solid food, you should chew it until it's juice, right? Because he was a big juicer as well. So he was like, even if you're drinking juice or drinking a liquid, you should swish it around in your mouth before you swallow it. So you're getting this proper activation of the,
Yeah.
I don't think he mentioned the nervous system, but of, the gut, right? He went right to the gut that, you have to have the signaling process going through. So I think that's really important. And another thing I wanted to note was in our conversation with Diana Marshall, she mentioned with babies, the suckling actually of the breast stimulates like the suction of the mouth, right? And you can get into the discussion of mewing, but it creates that pressure on proper jaw development as well.
Oh,
And
yeah. Oh,
um,
without a doubt.
actually
It's
moves,
no.
you know what I mean? So it's a
Yeah.
really interesting connection there.
Yeah.
So it's, because something I thought of that was, it was like, so where babies aren't supposed to eat soft foods, well, they drink milk for years and they can develop fine, but it's very different than drinking, some juice or something out of a bottle
Yes.
than actually having the suckling motion, which almost stimulates in the same way as chewing something like that, right? So,
Yeah, and then a lot of people they watch this baby struggling and they go, "Oh, that's bad." Like they're not attaching properly, they're not doing this. And side note, um, there's a study done which is amazing where they have newborns and they're premature and they have problems with attachment, basically because they've got immature nervous systems and they haven't figured it out. It's like teaching someone to shoot a basketball at the first. Not going to get it in the ring. They're not going to get it straight away. Like it's anything where an activity is not being done before, and in particular, babies, like they haven't done really anything before. So to expect it to happen straight away is not there. But what they did was they had a group of these babies, and it's a terrible study in that not all the babies got this, but one group got literal electrical vagus nerve stimulation through the ear, one ear, only one, and at a low level, and the other group didn't. And there was a considerable difference in the time it took to latch. So the vagus nerve group, they latched at a much, much faster rate. I can't remember the exact rate, but it was quite compelling research. And that essentially is the fact that the vagus nerve is a key component of this activity. And once the vagus nerve is more active, they're more able to do suckling or to try to feed. Coming back to feeding itself, the struggle is where it's at. If you don't struggle to achieve something, you're never going to learn to do it, adequately. So people avoid struggle and they see someone struggling and they give them a helping hand. Well, they're never going to learn. If people don't struggle, they don't learn. They don't develop. So we need to see our children struggling for the food, struggling for the thing, struggling to get it where it needs to be able to be eaten, whatever it might be. But what we do is we just hand feed them. It's just constantly make it easier, and that means they don't develop, not at the same rate of which they should. And that's what's happened. I think a lot of these situations where, and it also goes to talking. So the more they struggle through eating and baby-led weaning, as an example, or through breastfeeding, it's more likely that they have the neuromuscular structure to speak at a much earlier time and with better articulation. So, these are all the things we need as a human being. We need to be able to communicate. We need to be able to eat. We need to be able to feed ourselves. And I just think that people don't put enough emphasis on that. And it changes the structure of the face because we're getting in the way of the natural progression of things and how things would have been in the past, because we have all these things that make things easier. But is it really good for us? It doesn't seem to be.
Mhm.
Hmm.
Well, I mean, we could see that in society today, right? We are
Hmm.
constantly seeking comfort and the
Exactly.
expedient route, right? We're always reaching for the phone, rather than pursuing something that's difficult and meaningful in the long term. And you see the repercussions. You see them spiritually, you see them mentally, and you see them physically, right? Like
Yeah.
always going for what's expedient rather than what is meaningful. And the meaningful passage is often the more difficult one, right?
Oh, without a doubt. And the net gain is much higher down the difficult route, you know. And you look at even just on a day-to-day basis. If you go and do difficult exercise, if you go into the outside, and you're like, oh, it's a bit cold. Oh, it's a bit hot. Oh, that sun's in my eyes. All these things, they're difficult, but you build your tolerance to them, and we do, and the benefits are exceptional. And then we just don't want to be that lazy, easy life person, because we look back and we have nothing to really say and feel proud of. There's nothing. And I look, we're all guilty of it. We're all guilty of not doing what we set out to do or like to do, because that's innate in human beings. We look for the path of least resistance. But we also have a very clever mind, and that mind is able to overrule and say, no, this is a better way. Let's do this. So I think we need to remember that.
Mm. Yeah, I think that's really important. Yeah. Yeah, the last thing I kind of wanted to touch on was your background in dance. I think that's fascinating how you've come to where you are now from that background. And I
Certainly
think that's,
eclectic, isn't it? Yeah. People don't
yeah,
really know
right.
this. Yeah. I was a ballet dancer, classical ballet dancer with the Royal New Zealand Ballet. I'm Australian, but I danced there. And I trained at the Australian Conservatoire of Ballet in Melbourne. Um, that was my life, everything. It meant that I did distance education for the majority of my childhood. That's probably why I think laterally. Wasn't told what to think.
Yeah.
Trained full time, and then uh, got into New Zealand ballet. I deliberately went to New Zealand because it was a great ballet company to start with, because it was a smaller, 32 dancers. And my teachers were from there as well, and they recommended I go there first. And it was really good. It was fantastic. It was like a family there in New Zealand. And New Zealand's a lovely place if you ever get to go there. I've been to nearly every single part of New Zealand. I've been there. I lived there, obviously, and then I traveled back twice again. For everyone else who's not aware of, New Zealand is like these two islands southeast of Australia that most of New Zealand is pristine, like it's untouched. Although they've removed a lot of the trees initially for farming and grazing. But this is where Lord of the Rings was filmed, and it is a spectacular place. And so I lived there, danced the New Zealand Ballet, and then eventually I retired. I retired mainly because I'd lost a lot of passion for it at the time. And I don't regret it, because it's a very difficult field to stay in long term financially, because you don't earn a lot of money in the arts, and physically. Although I retired just for personal reasons. I wanted to have a change. And so that's when I went and did my first bachelor degree after that. But in the meantime, I stayed teaching and choreographing. And then eventually in 2019, situation came to the point where a company, creating a ballet company, would be appropriate. It's weird how things just happen like that. I always wanted to do it, but I didn't see a way to do it or a route to do it. But just emerged, and I started my my company, Brisbane Ballet Company, which is my city I live in, and that would eventually be. I renamed it to Ballet Infinity to make it more internationally palatable. And my wife is pregnant at the moment, so we're kind of on hiatus at the moment until maybe later in the year get back into more shows. But I've created it's getting close to 15 ballets. Yeah, so I choreograph, and I've danced a little bit in the last few years when I came back. I choreograph ballet and kind of modern ballet, contemporary kind of work. Yeah. So it's an interesting field to also be in. It's my artistic expression, and it's where I go. That's where my passion goes. Although I've got great passion in the academic work and clinical work I do, it's very different to the work you do in arts. Arts is, in some ways, you're never happy with the result, but the process is what you strive for. So, yeah, in arts, it's more, for me, it's more about the development of the artwork than the actual appreciation of it thereafter. That's hard for a lot of people to understand. Like everyone really thinks, when you go to see a ballet, you go, oh, you think the choreographer generally would say, oh, I'm really happy the crowd loved it. That's what makes me feel good. What made me feel good was developing it and getting it to the closest state that was what I had in mind,
Hmm.
which is very hard when you're dealing with people, not a canvas. Yeah, it's
Sure.
different in choreography in that way. Mm.
Yeah. I can't lie. I kind of see it similar in academia and sort of the liberal arts, understanding the natural sciences. It's a lot about the process because I question a lot whether we can
Yeah,
come to a point where we can just sit back and sort of appreciate what we've done, right? There's always a
I
little
think you
more
have to
fine
do
tuning
that.
that you can do.
I think you're
Yeah.
right. You do have to appreciate where you've come from and how far you've come. Like every day, I'm reading papers on PubMed, whether I agree with PubMed as a source of information or not. It's the best go to at this point. And constantly looking for answers, constantly questioning everything, and that's what I mainly post about. I just constantly putting up things that question the main narrative or enlighten people to what I've learned. Um, and there is a bit of artistry to that in a way, because you've got to reinterpret information. You've got to reinterpret everything, rather than just accepting things at face value. A lot of people find it hard to break from that, and they don't see it as the art form that is research. And I think, yeah, for me, like the ballet world is not a world in which I particularly like. It is politically, ideologically driven. It's full of very different people to me. I'm probably in many ways a right wing nut job to them. I'm not. I'm agnostic. I'm agnostic about most things, but I don't really sit perfectly into the right side of politics. But ballet is a tendency towards more the left side of politics, and there's more people on the left in ballet, and so a lot of the work that people do is driven towards gender ideology or things like that. Um, and for me, ballet has always been pretty much about romance, about love, about the kind of male female dichotomy. Literally, kind of the opposite. It's not fluid at all. And these stories are very old ideas. And I think that in many ways, ballet is quite the opposite to what they think it is. But ballet, unfortunately, is being attacked. It's not any way suited to the majority of Western countries anymore, because it is very European, and it doesn't get a lot of funding because it is so European. It's not like indigenous, which has its place, of course, which is a real problem. And in many ways, ballet is becoming a lost art. I think in Germany and France and England, they haven't started doing that, but in Australia, they have. And that's a real shame. And I think in Canada, they have too. United States as well, to a certain extent. But we need to keep this art form alive. It is a quintessentially European art form, and people love it, but people don't love it being kind of mutated into some ugly form that doesn't really represent them as a society, which it kind of is going through at the moment. Sorry to go off on a tangent there, but
No, I
it's
really
kind of a
appreciate
lot
it,
of people
honestly.
have to appreciate this in other art. People, particularly in this realm, in maybe more the right side of politics, they would say art doesn't really represent them, because it's gone really in a weird direction, and that's certainly the case in many situations. And ballet has that as well, and dance. But I'm trying to represent traditional values, uh, reason, and understanding in the way that I see it in dance, and I truly believe in that, and I think that arts is a really good way of expressing it, so that it's part of the culture broadly.
Yeah. Well, I think we've seen a bastardization of, the fine arts, whether it be architecture. Look at the state of architecture compared to what it used to be.
You're right.
Uh,
Yeah.
look
Yeah.
at modern art. Look at modern art. The modern, I despise it, to be honest with you. And same with music. Music is very different than what it used to be.
Yeah.
Like you're saying in dance, let's say film, literature as well, right? We're seeing it kind of across the board. And something that I found really compelling when studying Carl Jung was that he mentioned the arts. He referred mostly painting, because obviously he did a lot of work with painting and drawing, or expression through a creative outlet like painting. He mentioned that the collective of what is maybe popular in painting or in art is almost representative of the collective unconscious, right? It's indicative of the state of this consciousness that precedes us all, right? So that was his kind of way of explaining it, and I just thought that was so interesting. Just looking at the, I would say, deterioration of these fine arts.
Yeah. I think, generally we would say, 'cause my mother was a painter, an artist. So I grew up with art as being kind of at the forefront in my family. She would say that art is anything that it has an emotional effect on you. That had more elaboration as well, but I think a lot of art is for shock value. It's not for emotional value, right? It doesn't develop you emotionally; it just shocks you. And I think that that's where there's some confusion. I'm not against modern art, mind you. My what I call modern art, like, may not be what you call modern art. Definitely, a lot of modern art is structural, not paintings per se. So, and are very experimental. And this is mostly just trash. Yeah. There, but looking at the masters of the 20th century, um, like Jackson Pollock. Jackson Pollock, for many, is modern art. He's my favorite artist, and probably Rothko. Now, a lot of people don't like it because they don't see anything in it, right? And the reason I mention those two modern artists is because what what I personally achieve out of looking at them is that I actually can create choreography just by looking at it, because it creates an internal spark in me, creative spark in me, that other artists don't. I can look at something like Monet, or Rembrandt, or even Da Vinci, and I don't get anything from it. But visually, it is an exceptional work, right? And many people would have a different experience. This is objectivity of art. Other people will say, I have an amazing experience when I look at that Da Vinci or that Caravaggio or whatever it might be, but I don't. I just see its beauty, but don't get an internal change. But I go and see a Pollock and I go, my entire life has changed. So it is something that a lot of people are, it's subjective.
Yeah.
So and this is why art is so important, and variety. not just classicism. We can't just have neoclassical architecture,
Mhm.
but then there's also modern art, modern architecture that there's nothing on us, no effect on us. I went and I saw Gaudi's church, Sagrada Familia, in Barcelona, and I have never had an experience like it. And it is technically modern architecture. It's architecture as art, and it was exceptional. But here is an example of modernization of architecture that has not lost the soul of the art form.
Mm.
And I felt that way about Pollock. But that's just my experience. And so for me, the way that I look at art is if it makes me want to create art, then I should consider it as a way to, if it makes me want to create art, then that is for me the best type of art. Something that gives me, spurs me on to create. And if I see, like my way of creating art is through movement. That's my own way. I'm not a painter. I'm not a musician. I'm not, So if I see movements, as strange as that sounds, if I see movements listening to music, if I see movement looking at something or being around something, then this is good art to me.
Yeah. Oh, well, I really appreciate that take. And, I'm sitting here kind of psychoanalyzing myself. Maybe I read a little too much young, but I'm thinking maybe my hatred for modern art stems from, my quarrels with the modern way of life. And, I'm just
They
kind of
can be,
deep
yeah,
in thought right now, you know?
yeah. They're same in
Yeah.
ballet. Like there's modern ballet, modernized ballet that people hate. They hate it. I love it. There's a choreographer called William Forsyth, and he did post-modern. People hate that term. Post-modern ballet, and it's the deconstruction and reconstruction of ballet, essentially. And a lot of people just don't get it, and that's fine. It doesn't mean it's a failed art form, and it doesn't mean
Sure.
it's a failed art form for everyone. Um, that's why we need the diversity of art. But I do think the shock value of art is kind of irrelevant. It's all about how much it moves you and changes your internal milieu or your morphology. If it does that, then it's achieved its goal.
Mm,
So it just may not be for you.
yeah.
you know,
Yeah.
yeah,
Yeah, I think that's interesting, that shock value that you're talking about because, it's all about the hook nowadays, right? If we're not
oh yeah,
hooking people on, it's they're not getting captured by it. I was in Europe recently and, we're going through museums and a lot of people are rushing through the museums. They're
sorry, my prog has
they're
just
just
come out.
having a look. Oh, good.
They're rushing. I
They're just
know. I found that. Sorry about that. I found that in the Louvre, there was so much to see. People don't have the time to sit there, and really, every piece of art needs half an hour. It's a modern
yeah,
thing, isn't
well,
it? I think it is. Yeah.
absolutely. Yeah, absolutely. And yeah, I did the Louvre and it was rushed. You couldn't have enough time in there. And um, my favorite museums were the smallest ones, right? You spend the same
Yeah.
amount of time or more in them, right? Because you spend more time appreciating the pieces that speak to you as well. Because yeah, I think that's interesting. Not every piece spoke to me either. I think that's a really interesting point too, that, it's not just because it's classical either, worth a lot of money, but then people's sort of worldview gets intertwined as well. This is the most expensive piece, or everyone's there
Yeah.
lined up for the Mona Lisa. And look, you're in the room looking at the Mona Lisa and you're looking around and there's, 30, 50 other beautiful paintings that are seemingly much more intricate than the Mona Lisa. I know there is an interesting story behind it. And,
Yeah.
um,
I
but
think most
it's
people
just
feel
it's
this
just
way about it.
interesting
Yeah.
to see, like
Musea
anyways.
d'Orsay. Did you go there? Musea d'Orsay, which is
We
the
no, we didn't actually go. No, not
impressionist.
to
Yeah.
Belfast. Yeah. Yeah.
I
No, we
mean, I'm not
skipped
an
that one.
impressionist artist fan personally. I all art I love, by and large, but art needs to really move me. I recently went and saw the masters' works. Like a lot of the Titians and Caravaggios and Da Vinci's and things like that. and I got a lot out of it, but it didn't change me. And I don't know whether that's just cultural or my mother's influence because she loved Pollock and things like that. It's partly that, I think, um, and whether their aspirations as to why they created that art is different to why I create art. So there could be a correlation there. And definitely artists don't look at art the same way that the general public does. General public, I think, often will say, "Oh, that's a famous work. Well, really proud to be here and see it." That's how they kind of view it, and they walk past grand masters' works they haven't seen before, have heard of, so they just ignore them. But they're not famous enough for them, And like that happened at at the Musée d'Orsay. There was all these Edgar Degas, pieces of ballet dancers, and I couldn't care less about it. Like everyone's like, "Oh wow, look at that." Okay, okay, can we move on? Like this is, that's just me, and that might be my version of your modern art, but
Yeah. Yeah.
every situation, every person has a different life experience, gets moved by different things, and I think it's fair. Some people love heavy metal, some people love, or like for me, awful music. They absolutely love it. It moves them. It makes them feel great. Okay, good. Classical music, we haven't really touched on that. Is the music I listen to predominantly, like 90%, which for many people is boring. So, but I have a connection to it. Is that when I listen to music, I see movement, and so
Yeah.
I have this add-on, which other people don't have, and it makes it far more interesting. Sit there just choreographing new ballets in my head all the time. One day that might be useful. Um, and that makes it far more enjoyable, far more engaging. But other people just don't have that. So, they will experience it differently.
Yeah. Yeah, it's funny. Yeah, no, that's really interesting. It's just it's so individual, right? And we keep coming back to that.
Mm.
I'm a big fan of I love classical. I love classical, but my heart is out with the outlaw country. That's it. Old Waylon
Country.
Jennings, and
Wow.
that's pretty much it, right? And it's like, you're listening to these songs and it's sad and depressing, and oh my goodness, it's all about, but the stories that I like, it just moves me for some reason. I
Yeah.
just think it's the most fascinating stuff to, look at the pain that these people have felt, right? And they're talking about it, and I think in a way they're trying to teach about this pain. They're talking about having the freedom, but freedom comes at a great cost. And of course this could require greater discussion, not freedom in a political sense, but to be truly free from all responsibility, you have to
Yeah.
have absolutely nothing to lose, absolutely nothing. So I just think it's fascinating. But yeah, that's what I get onto.
Well, it's a great thing about nowadays with music. You can access nearly everything. There's not a
Well, that's
situation
it.
where you have to go and search for CDs or records in a shop. I have every single known, well, nearly every single known classical piece at my fingertips. It's amazing. Like it never happened before. So we're really
Yeah.
lucky we can be exposed to any and everything and take our pick really. And it's a great time to be alive in that way. I think we're quite lucky.
Absolutely.
You tell people 30, 40 years ago our lives, and they would not believe you. They would not believe you. Yeah.
Yeah, 100%. Ah, that's awesome. Yeah. No, this has been another great chat. I think we covered pretty well everything I want to talk about,
Yeah.
and
Good.
great discussion at the end. Yeah, I really like that. I think and this might open up a little can of worms, but if you're up for it, to hear a little bit about that, you mentioned earlier that sound wave that you're using with
Shockwave.
the
Mm.
shockwave, sorry. Yeah. I'd like to maybe hear you touch on that a little bit if you don't mind, if you have the
Yeah.
time.
Yeah. We do. Um,
I'd love to hear about that.
so, Shockwave is developed from a device called lithotripsy. And lithotripsy was developed to break kidney stones, and it's still used, although they also use lasers now with kidney stones. Lithotripsy got repurposed to a product called shockwave therapy. And it's essentially the same, except it's not as powerful. You got to remember that lithotripsy is under a low general anesthetic. So it's very painful, and the amount of shock wave going through the person is much higher and much more pinpointed to break a stone. But for shockwave, it's broader and it's not as intense. It's using a sound wave. So it's it looks like a gun and as pressure wave goes through, and then it puts a bullet through a tube, and that bullet is like really hard, and it hits another like panel, which is it's called an applicator, and that applicator is made of metal, tungsten, bangs it, and then it creates a sound wave. And that sound wave can be put at any frequency you want and any intensity, and it can be broad or more pinpointed. And traditionally, it was used for things like plantar fascia, tendinopathy, like Achilles, things like elbow, and they were like, well, it helps to, enhance repair, things like that. No, with full knowledge that it's inflammatory. And we know that that when you test the specimen it's in animal models, of course, not human models, when you shockwave a specimen, the inflammation levels go right up. All the markers go up in that tissue that they've shockwaved. And also the repair enzymes. So whether you believe in genetics or not, the kind of markers of repair activity all go up. And it does another thing which is really interesting. It creates this weird pressure that forms a thing called a micro bubble. And this is only really ever seen when you create vortices, whatever that word is. And so it's clear that the shock wave, when applied to tissues, the water itself goes into a vortex due to the pressure gradient. So the pressure, you've got a system, and the pressure goes in, and the system gets pushed, and it goes into this vortex, and it probably rotates from there. That without the vortex, you wouldn't get these micro bubbles. And so it's my opinion that on top of every other positive thing to do with repair, it also structures water. So I apply it in the same way you would. Many people believe it takes about 30 seconds with a vortex to structure water. There might be other numbers, it's hard to say because you can't see the structure internally with a microscope, so you go by feel. Generally, I hold a point for at least 30 seconds to get a change in the structure of the water, of the nerves and the cells. And it is my opinion that is a big part of how it works. Also, why I use infrared light therapies. Infrared is a known thing that structures water, so you do that as well. And it's likely that's one of the main reasons these all work. But shockwave is incredible in that the results are almost immediate. Whereas other therapies, it takes a bit of time, a couple of days, maybe the next day to see results, whereas shockwave is almost immediate change. And that makes me think that it's to do with the restructuring of water because it does that in real time. It doesn't take time to go through the repair process like everything else. The repair enzymes will proliferate and inflammation goes up, and then it goes through a peak and a trough, and catabolic, anabolic phases of inflammation and repair. And then that will be a few days later. And people do get a change that is a few days delayed as well. But there is an immediate improvement. And so I use it on vagus nerve issues predominantly, as in regards to what we've been talking about, on the nerve itself to help repair it in the areas of which it's likely damaged. It's also to improve its neuromobility and to resolve any underlying neuropathies that are there that are contributing to it. I also use it on tissues that are damaged, and it's used on fractures as well. So fractured bone is well known to be a difficult thing in certain circumstances, like health-related issues that are preventing people from healing, or they've failed to heal for whatever reason. Often it's like drinking and smoking, things like that. But either way, you don't even need to consider that. But the point of it is that the shockwave can be implemented if you're healthy or not, and it will rapidly increase the healing rate in bone. And so my experience, and that's backed up by the research papers, is that it generally will halve the time that it takes to repair a fracture. So if it normally would be a 3-month repair, if it's pretty bad, you'd shockwave it in the correct way, you could get that down to under 2 months, a month and a half probably, to full repair. And then there are other factors with fractures, which are to do with nerve entrapments associated with the scarring and the adhesions, which are separate and they need to be treated accordingly. But the shockwave has got many, many uses. In fact, I've used on endometriosis and have been able to put people in full remission of endometriosis. I think the big one is Crohn's disease and autoimmune conditions. So when you've got tissue that's damaged, say Crohn's and intestinal tract, you can apply the shockwave to that tissue and initiate more inflammation and therefore more repair. And every single case I've ever had, I mean, knock on wood, has resolved their Crohn's with shockwave. And, this is not just shockwave with Crohn's disease, IBD, and ulcerative colitis as well. It's also that you will do vagus nerve work with them as well. Most Crohn's will also have a vagal component with them, and that's why they got developed in the first place. And dietary interventions are good too. Like a lot of people try carnivore or carnivore fruitarian or keto even, or just low grain levels and low fiber. These are useful sometimes, just to just reduce the load on the gut. Doesn't have to do as much work during repair. So focus on repair, not on digestion. Other things that I use it on. So I mentioned any damage to organs, so that's very useful. You name an organ, it's likely I've done it and had some success. But even things that you wouldn't anticipate. So one of the ones that I found incredibly interesting is its alternative to using prolotherapy. So a lot of people get prolotherapy. It's an injection of dextrose. And dextrose is an irritant, so it creates inflammation. And the hypothesis is that dextrose irritates the tissue enough to create collagen depositing down and making that joint more stable. So it's used generally for really unstable joints. And a lot of people get that when they've got neck instability, particularly if they can't do neck strengthening. But what's remarkable is that shockwave has the same effect. So you can use shockwave in and around the joints of the neck, and you'd think something that's kind of pulverizing someone should actually make it more loose and all over the place, but actually it stimulates the collagen and the repair. At least for both cases, it's theory with Prolo as well as this. And the neck is more stable. I do wonder whether it's more to do with the nervous system activity, but either way, if you don't have to inject something into you and you just use sound pressure waves, I mean, it can be a bit uncomfortable receiving it. Certainly would be a better option because there's less complications. There are many other things that I use it on, probably just forgetting, but there's nearly everything there's an option for shockwave. Yeah, shockwave is just a good adjunct, but it's my primary therapy, along with light therapy, needling, and other things as well, to just stimulate healing, a change in the nervous system activity, mostly to do with structuring of the water, and to improve the overall behavior of the person, meaning their muscle activity and pain levels come down. Yeah.
Amazing. Is there worry with EMF with the sound wave?
Yeah, so nerves don't like EMF. I might have mentioned to you the study done with mobile phones in the hand. So it damages the nerve under the hand itself, median nerve. So it's clear that mobile phones are damaging the nerves. That was a randomized controlled trial done. And they could directly attribute it to the amount of electromagnetic 5G, 4G, whatever radiation. And if the phone was on, but I think from memory, if the phone was on and didn't have the data, it was just on, the heat wasn't enough to do it. Heat doesn't cause damage. One of the things that a lot of people will say about phones is just, it's just a lot of heat. It's not radiation like we're talking about. Yeah, obviously the phone's thermal, but thermal is not damaging, right? So
Mm,
it's definitely the cellular network that's doing it.
interesting.
Other EMFs, it's hard to say. I'm not sure if you talked about this with Daniel Reuters, where we talk about it all the time. Things like EMFs really are these the main problems. I am a bit skeptical that 5G is the problem. I know people will say they'll link it up with like metals and that they activate metals in the body, and I mean, it's possible. It's very possible, but there are many, many other explanations. Like German new medicine throws a spanner in the works, like a lot. Like it throws a lot of stuff out potentially. And my feeling is that it's probably more that. I have a feeling we're far more adaptable than when we make out than we make out. Dr. Harmon didn't believe toxins were as bad as people made out as far as these conditions were concerned. He like we're more resilient than that. And that actually does ring true to me in my gut. It does ring true, but there are certain things that damage the vagus nerve as a primary and not other nerves because they're not at the interface with these. And that may be the only kind of example or one of the only things where it doesn't apply.
Mm,
But I don't know about EMFs as far as obviously Wi-Fi is a problem, and it's very hard. I'm about to buy something that makes my whole system wired, and not there's no Wi-Fi in the house as a result, but there's Wi-Fi from next door. And if you're in an apartment, well, you've got like 15 signals going through your house, so it's very hard to get away from Wi-Fi, and we know that it definitely affects hormonal function, and it definitely affects your ability to have children. So, what more can it do? I mean, who knows?
yeah.
But I'm definitely on the more path with that. But that's as much information that I can confirm in my mind. A
Mhm.
lot of people will go like do a whole lecture on it and will say it's the cause of everything almost. I don't think it's that, but that's like I don't think that eating certain foods is bad either. I think that it's if people want to catch on to one thing and then take it to another level where it becomes the be all and end all. You know, that's why a lot of people move out of carnivore and start eating fruit because it's hard to sustain a carnivore diet for a long period of time. Personally, and I understand from a toxin reason because there's far more toxins in grains and vegetables than there are, meaning metals. But like it's hard to sustain, and I'm not convinced that it's the be all and end all. And it's also a psychological thing. Like if you fear, I did a recent post, you probably saw that, about germaphobes and how they constantly are scared of,
I love that.
they're constantly wiping their hands, constantly wearing masks and completely forgetting the fact that they're being exposed to other toxins, which are far more problematic and probably more real. Um, and I find that quite ironic. Yet, um, I don't want to become a phobe too much of everything. Like I think there is a psychology to that. If you fear everything, you then develop disease, according to, I mean, in some ways, according to German new medicine. Like fear is a problem in itself, but maybe just a healthy balance. Just
Mhm.
try to avoid as much as possible. I drink distilled water for that reason. I only drink distilled. I don't want anything in that water at all. Like I don't want that to be a source of toxicity for me. So I do what I can. I do what I can. I
Mm,
think everyone does try in some ways. Yeah.
yeah. No, I think that's a good perspective because, fear, I think, is a universal killer, whether you
Yeah.
fear a vegetable or a certain toxin or EMFs or germs or, I do think that the fear is always worse. The stress is always worse. I thought there was an interesting thing I heard once. It was like a happy pizza is better than a sad salad. Now, I don't think, you know, they're on the right track with salad being the healthier
Yeah, I
option.
agree.
But,
Yeah. Yeah.
I think like I certainly think a healing thing for me is going for Sunday dinner, eating a chicken dinner, and I'm gonna eat the vegetables on the side. I'm not
Yep.
gonna fear those vegetables, and I'm eating with
Yeah.
loved ones, and usually we eat a lot slower when you're eating as a family, and in the presence
Yeah.
of loved ones, as you were mentioning earlier, being a really important factor. But there was a time where coming off this sort of germ theory perspective that I had, right, in my earlier years in university, right, I was all rah rah root modern medicine, germ theory and all that. And then the transition was, you know, now I got to fear all these toxins and I got to fear the chemtrails and the
Yeah.
radiation and there was even a point, I didn't really buy this one, but everyone was kind of worried about the vaccine shedding and oh, I
Oh
shouldn't have
yeah.
said that
No.
word.
It's
But
yeah.
you know what I mean? Like
It's
people
different
are just
levels, isn't it? It's
scared.
just different levels of fear, and then just it's
Yeah.
innately in us to fear because otherwise we wouldn't survive. But
Hmm.
um, I do think at some point we just got to live our lives, and enjoy it time to time. Like you said, just family dinner. Like who has that? Who has that with every meal? I mean, that doesn't. And like it is a factor. And I do talk on health all the time, but they're like, so what should I do? What should I change? Like how am I going to fix this problem? Like, well, um, firstly, stop worrying about it. Like that's if you keep worrying, I mean, it's worse. You can manifest disease that way. It's like people with their injuries, and when I tell them, I say it's actually not that bad. You need to get rid of that moon boot you got on and start walking normally. You don't need it. And
Hmm.
once people unlearn some things about what's really harming them, Daniel's done some good work about the psychogenic causes of disease, and it's in his book. Can You Catch a Cold? Just a bit of a plug there for him. The
We gave that book
you know
away on Instagram
it's a
the other
great book.
day.
It's a great book. It's on my bedside at the moment.
Unreal book.
Yeah, he talks about psychogenic causes, and it's amazing. That's probably what happened a lot with COVID. A lot of people got sick just because they thought they should be sick because they got someone was near them, and you manifest it. And we won't go into like why that is, but the point of it is that if we constantly fear an outcome, a thing like fear cancer, what's great about German medicine is like allows you to not fear cancer, which is great. Like it's an amazing thing to remove from your list of things that you're scared of, right? But if we constantly fear, we're not really living, are we? We're not really being in the moment. And what's the point anyway? If you're not really being in the moment at all times and enjoying life, enjoying your time with your loved ones, enjoying watching your children grow up, enjoying being with your wife or your husband or what partner, whatever, or your friends, family, what else is there? And I just don't see a lot of the people I work with are obsessed. They are obsessed by their health. And there are people who are far sicker who aren't even bothered by that. They're more interested in their family. They're more interested in things, and they do far better. They're more interested in their connections and enjoying their life, and they're far more able to change. I can tell you now. Even if it's just a starting point, like one of those non-negotiables, like, are you actually putting, this diagnosis on a pedestal, or are you just moving on and still enjoying every day as it comes? Everyone might say, "Oh, yeah, but you can't enjoy it if you're in chronic pain." And look, I understand that, and I understand that chronic pain stops you from getting from A to B and doing things and enjoying.
Hmm.
But it does pay to change the way you think about conditions, and that's why when I talk to people and I explain it in a different way to the way they've been told, classic one is, I've got bone on bone in my hip, and that's why I've got chronic pain. And of course, that is not true ever. There's no correlation between level of degeneration and pain. It's just a proven fact. It's unrelated. And I say, well, that is analogous to wrinkles. The more wrinkles you get on your face, the more degeneration you'll have in your hip. They are from the same cause. It's called aging. It's not because you've got chronic inflammation. It's not because you've got X, Y, and Z, and it's not the reason why you've got pain. Do those wrinkles cause you pain? No. cartilage doesn't have pain receptors. And saying stuff like that, people then go, oh, well, my surgeon said, and I think that's where power in these doctors is too much, and they have a big effect on people, and that can lead down the track of, I'm not going to enjoy my life until I get this surgery, or until I get this drug, until I get over this pain. Like, they create barriers to living their life. I will not enjoy my life until I get out of chronic pain. I'll spend the rest of my life trying to fix it.
Yeah,
There are other reasons for chronic pain, I can tell you now.
definitely. I think the diagnosis is the most problematic part, to be
Exactly.
quite honest with you, especially with the
Diagnosis
weight
shock.
that the absolute shock. Yeah. Yeah, but I mean the weight that these, we place these experts on a pedestal, right? The weight that they carry, their words carry a lot of
Yeah.
weight with us and a lot of meaning. And there's an interesting psychotherapeutic technique that I've been looking into a little bit. And we learned about it in school, actually, funny enough, in my master's, and it's called the narrative technique. And largely it's concerned with taking your problem and putting it on a chair in the room and acting as if it's a third party. And rather than identifying with these problems that you think that make you as a person, right? Like, I'm an anxious person. No, you're not an anxious person. You know what I mean? Like, I am a
Labels.
depressed person. I am a cancer patient. You know,
Mm.
that holds you into that mindset of,
I agree.
you can't be anything else than that at that point. And when I was talking with the Biggleson brothers, it was just so absolutely amazing. They were talking about, how their father healed so many people of cancer, and it was like a 1 month intervention, and this lady came up to him after, and she says, "Okay, well, so when do I have to come back?" And he says, "Well, you don't, you don't have cancer anymore." She's like, "Well, what am I gonna do? What am I supposed to do? Like, I have cancer. I'm a cancer patient. Like, what I need, I can't come back and see you again." And he's like,
Mm.
"No, you have to go and live your life,
Yeah.
and focus on the relations and the living." So it's kind of funny how this can really pigeonhole you into this idea of, I am this, I am that, whether it be negative or positive. You can see it with varsity athletes a lot. They get held up in this idea that they're an athlete, and then school's done and they slip into this depression and they don't know anything about their
Mm.
identity, and they have problem. I see this a lot in sort of my age group right now. I think it's really problematic. They come out and they're like, what am I supposed to do? Who am I at this point? They're like having this identity crisis. So I think that's really interesting. And I think taking the weight off these diagnoses or whatever it may be, I think that's half of the battle there
Well,
too.
it's got to stop them from getting better. In many ways, I think, going back to Dr. Harmer's work, and so initial emotional reason, like, I've got cases where something happened to them. It was devastating, but they didn't want to deal with it. And they developed a condition thereafter. And it might be any number of conditions: autoimmune, cancer, degenerative diseases, things like that, or dysautonomia. In some cases, it is that um, when you breach the subject of what happened, you can tell it's unresolved. It's unresolved. It's not one to go to. And I've found these conditions to, and part of the diagnosis is like, oh, I've finally got a diagnosis for my problem, which further eliminates the need to go back and deal with that emotional problem.
Ah,
And I think that's what diagnostics do. They distract from the original cause. I take a broader approach. I explain what that diagnosis means structurally, at face value, objectively, what it really means. Does it mean anything at all? And
mm,
I do think sometimes you can say, look, I will do my best to treat that, but we also need to deal with the original cause. Like, we need to deal with this
mm,
emotion that you've not really processed. And sometimes it's, for women, a lot of it's like if they have failed IVF, for example, they may, or they have a breakup, men or women, and they might feel that might be the catalyst. I've seen that so many times. A breakup is what I'm not able to have children as a result. And it might present in numerous ways, according to Harmer. But I've seen it as a common one for women. And then they aren't really dealing with that. They don't see the correlation, firstly, but then they don't deal with the facts of that because they don't know if they can process it. And I don't think every psychotherapy method really works for everyone. In some circumstances, it might be EMDR, it might be brain spotting, two things I do like. Hypnotherapy is effective for some people if it's done right. Other forms of psychotherapy, more traditional ones as well. But it's not going to be the same for everyone. Not every therapist is going to work well for you. And maybe it requires some actions of your own, some lifestyle changes, some structural changes in who you talk to and what you talk to them about, and things like that. And I think if we have that down as a potential root cause, then we don't negate it and we don't focus on this diagnosis of cancer or diagnosis of something else like rheumatoid arthritis or Hashimoto's disease or whatever it might be. And then you're constantly trying to fix that. If you only deal with the emotion, I think that is fine. But I also think it might be of greater value to deal with both, to assist the body through these patterns, these sympathetic and vagotonic phases, or which way you may deem appropriate. And that I think that's more holistic. And then they feel like at a non-conscious and at a conscious level, something's being done. And that has a positive effect on the body as well. Yeah. They're heading in the right direction. Yeah. We've got to have that. Got to give that to people. And otherwise...
No, I agree.
Yeah. And I think we can accelerate these processes. I've seen that. Mm-hmm. That's my experience.
Yeah. Yeah, which is why I think we can't negate the physical aspect as well, right?
Yeah.
In treating the toxin or the deficiency, whatever it is, right? Because
Indeed.
That fella I mentioned earlier that I was talking with, he said German new medicine will tell you that you have AIDS and you have a sexual conflict, but it's negating the fact that you're also a heroin addict and you're injecting heroin into yourself, right? Like it's like now I think that's a pretty extreme take on.
It definitely doesn't. I don't agree. That's not what Dr. Harmer would say. No.
Okay, well I
think that's just brushing over.
There.
Yeah, if you read one paragraph about German new medicine, you would say that. But you read his topics on toxicity, definitely it's a big factor in the development of diseases and stops people from going forward. Yeah, well, I don't think that's contradictory to say that.
Awesome, I love it. Yeah, I love it. That's great. Okay. Any final thoughts from you? Anything you want to add or you think you might have missed?
I think it was great to talk about German new medicine. I think that was an important direction to go in. I think that, we're in a field that is burgeoning. I know it's been around for a long time, but it's now far more prevalent in the psyche of a lot of clinicians. Daniel's book's really helping, and the Bailey's work, Cowan, Kaufman, and others, of course. We've all got our place as far as what we're talking about. My area is the nervous system. I think it's probably a missing piece, but I have that bias. I'll admit it. I think that as we get ourselves into a situation where things are much clearer as to what really is going on in the world of health in regards to the biology of the human being, we're going to start to see things change dramatically, in that people will not see hospitals and doctors in the same way, and doctors will have to change. It will change everything if we continue on this good trend that we're in, that we're on. And I think it's going to take a bit of time. I reckon it's going to take 20 years from now before we see it far more mainstream. It might take another 100 to get it into medicine, but we've got to start somewhere, and we've got to keep pushing, okay, and keep searching for the truth. even if it means we make some mistakes on the way in our hypotheses. Got to keep trying to find the truth. And I think, look, every month after since I last talked to you, I've learned many, many, many things, and I feel like I'm a different person still, and I'll be the same in 6 months' time. I'll be talking about other things on top of everything and saying, oh, what I said was wrong. Actually, we've got more evidence now. And so as the evidence emerges, we might have to just reorientate. But we can't stay on an ideology just because it's where we started. We can change and then understand that the direction that we're going in is the right one, but we will need to pivot as evidence emerges.
Yeah.
Be flexible. Be flexible. And don't throw everything, don't throw the baby out with the bathwater. Don't throw the entire lot out. It's a straw man argument to say that because you got that wrong, everything's wrong. I think we don't need to think of it like that. We can just re-examine it. Yeah.
Yeah. Yeah, we don't need to throw everything out, but it's valuable to question everything.
Exactly.
At least, right?
Bingo.
There's
I
no
agree.
need to.
Yeah.
There's no reason why something, if it is the truth, it should be able to face scrutiny in
Scrutiny.
depth,
Yeah.
like to great lengths as well. Like people's life work trying to disprove something. If it's the truth, it's the truth. Uh, and so there's no reason why we can't look back and rethink what we even know with the
Yeah.
terrain paradigm,
Yeah.
and I think that's important because we don't want to shift from one dogma to the next.
No. And
So,
we just don't want to become them. We did not want to become them.
exactly. Yeah.
Yeah.
Yeah. And I think that's going to be I think that's a challenging thing as you evolve in life too. I feel like people tend towards, closed-mindedness and stubbornness. I think that's
Yeah. You've got to
people
stay
generally
agnostic.
go
You've got
that
to
direction.
stay on the fence about everything and just wait and go, yeah, everything's possible. Or never
Hmm.
say that's not correct at all. I think we can definitely say that about germ theory though. But this is a post-germ theory world. We can say, I say autoimmunity is unlikely to be correct based on what we see. And it's more likely to be more of a reparative process, and you just, and we all fall for it. I fall for being, having hyperbole or something like that. Um, the main thing is to just remind ourselves that we're trying to find the truth. So that means that we have to question ourselves as well.
Mhm. Yeah, absolutely. Absolutely. Yeah. And it's interesting, like I've been looking into viruses a lot lately. Again, just kind of going through with a fine-tooth comb and um the idea of a viral particle is not something that's necessarily off the table for me now. Are they self-replicating disease-causing particles? I think that, that's been disproven quite well. But the idea of a particle like during cellular breakdown is not necessarily an absurd idea to me, right? Like I think there's still value in these empirical observations that are made that are used by this modern science, right? I think that there is a certain extent of value in it now. I guess we shouldn't get into this discussion too much, but you know,
Well,
I think that's what it is. Let's not throw out the baby with the
no,
bathwater.
I agree.
There's a lot that we can keep from the textbooks, right? Like, just a different interpretation, maybe a
We
different
just need to have a
induction.
different lens. We just different,
Yeah.
it's like the microbiome dysbiosis theory. I have a completely different lens on it. Like it's an appropriate change, and that those so-called things that cause it are actually, the remedy is in the change. So,
Hmm.
because I don't believe that microbes cause disease, I see them as helping us out. Then of course I'm going to look that in that way, right? And of course, that is in its own itself a bias, and it has its problems, logical fallacies and things like that. But something has to contradict the main narrative. We have to have a contradictory hypothesis to prove or to attest. At the moment, there is none. There are none. So my contradiction would be that they have a role to play and this is what they do. And here's some evidence for that fact. I have that, and that's what I talk on a lot. The bioremediation effects, things like that. And for people to say, that's not possible, they cause disease. I said, well, what evidence do you have? We don't have that, really. It's all circumstantial evidence. So truthfully, we're all both at the same position. Someone said to me once, you cannot put a post up unless you've fully referenced it. Yeah, but what if no one's ever thought about this? Literally, like you can come up with an idea that is revolutionary and no one's tested it, doesn't mean it shouldn't be mentioned.
Yeah.
Because the
Yeah.
alternative theory is still hypothetical. It's not
Mhm.
proven. So there's nothing to really, like, it's not like they have evidence, So yeah, that's why I get into rumbles with people.
Yeah.
Yeah.
Yeah. No. No, I agree. And I think, like you're mentioning, I think that it is important to note that, if you're concerned with empiricism, falsification is a very valuable method. Now, um, I don't think the, the consensus or the modern scientists really adhere to that, because we could see that a lot of these theories are falsified, right? And
Yeah.
this is the way to objectively look at empiricism, because it doesn't rely on any sort of induction. We can see what is wrong now. Um, I do think to a certain extent we are able to say that something's incorrect without proposing an alternative hypothesis.
Yes, I agree.
But I do think that there's only one way forward, right? We want it. We're looking
You
for
need
the
a new
truth. So
paradigm.
that
Yep.
is the way forward. But at this point in time, we need to get people on board with a way forward, right? If we're dogmatic in our thinking and closed-minded and thinking that there is no way forward, no one's going to go for it, right? So you do need to
Yeah.
disprove the earlier paradigm to get people moving towards a new one. So we may not have the empirical facts and observations and inductions that they have in the modern lens, but we're still able to say that this is incorrect. You
Yeah,
know,
like if
that's
I was in a position of, like high level professor and I made a judgment call on where the research should go, that would have much greater power, even if it's just on pure opinion. Like, this is the problem, right? Obviously, this is why, like, I think I might have mentioned it last time, not sure if I did. Neuroplasticity was always considered pseudoscience because none of the professors were willing to research it, even though all the younger ones were like, no, this is definitely real. And then it took them all dying out for it to occur and become mainstream. And now we accept that nerves change,
yeah,
because the evidence is there. But it went against their dogma, right? And that's what
mhm,
we need to battle. And but at a face to face level, like when we're talking to someone in a group, we need an alternative explanation. To is
yeah,
in
that's
an argument, you need an alternative, even though it may not be appropriate. You think, well, academically, you would say, for this argument, meaning to say that it doesn't exist, does not mean I need to give you an alternative. And certainly, if you're talking to an academic, that is true. When you're dealing with general public who are not academics, who don't think in that way, they think more, through their own experiences. Um, you need to say, look, here is a better explanation, and that is an alternative explanation. And you can create doubt by showing there are alternatives. And
mhm,
doubt is really important when questioning dogma. If you create doubt, then no longer that dogma doesn't have the power over you. And so that's a really good way to argue or to convince people. I'm not trying to convince people, but I'm trying to give them an alternative viewpoint that it's not as simple as you think. And let's make this black and white thing grey. Okay, now it's grey. Here is the alternative explanation, and here is the evidence for it. Are you more convinced by that? And here is the current dogma, and here's the evidence for it. Which is more convincing?
mm,
And maybe some will have their ideas based on their weird experiences that suggest that, oh, no, it's definitely that because, they have dogma themselves. But I think for a majority of people, they're ready to change. They're ready to get out of that dogma that they're in. And there's dogma in natural medicine too. Like it's full of it, like the whole thing. You know,
Absolutely.
green pharmacy, for example, dysbiosis, leaky gut ideology, all sorts of things which I don't agree on. Um, they need to let go of that in order to look at the new theory as possible. Because if that's wrong, it means what they've been doing was wrong. And some people don't want that feeling. You know, they
Mhm.
don't want the feeling of I've been, doing the wrong thing for the last 10 years or whatever. And that does not feel good for anyone. I certainly, my approach to say like a condition called SIBO was different, and I would give antimicrobials. I'd give this whole protocol that I would use based on my training. Now my approach is utterly like flipped, and it works. I always wondered, oh, SIBO is really hard to treat. If you use standardized protocols, it tends to want to come back. And you don't really you don't have the capacity to question it because I don't mean to go into SIBO too much, but it's like if you don't have an alternative that's credible and you don't have people telling you that it is credible, you're not going to go down that path. And
Mhm.
it took years of unlearning and learning alternative viewpoints for me to come to a completely different theory on that, SIBO, for example. And as contradictory as it is, it's a far better approach for me. And I feel so much more able to look at it and go, this feels more right. The other one didn't. It felt wrong doing it, but I didn't have an alternative. And we're just going to give people alternatives, and many will just come to this side.
Wow. I think that's amazing. I think that's very, very valuable. Um, Absolutely. I couldn't agree more. Honestly, I couldn't agree more. And in a
We
way,
just can't.
yeah, that
We can't fragment. Our group can't fragment, and it's already fragmented. And we just got to remember that we're all in it to find the truth. Don't push one narrative as being the be all and end all. You're actually damaging the terrain movement. The key is to stay agnostic about nearly as much as possible, meaning open minded and not falling for one in one way, and looking at all the possibilities and be ready to change at any point. And that's why I'm like, there's some home truths that we need to accept, that we're fragmented. And if we don't unify and work together, then the movement will be destroyed by ourselves. And it is a movement. And Daniel and I work together, from very different places, which is what we need. We need to diversify our knowledge bases and then come to a common new idea together and see how all of our viewpoints come together and how can we create unified theories, a
wow.
unified theory.
Mhm. Yeah. Yeah. Beautiful. Yeah. That's it. That's exactly it right there. Yeah. That's what we need to do moving forward.
Yeah.
Yeah. That's what we're working towards. And I just
Like,
think back to my chat with Phoenix Aurelius, like, Um, because even coming into this before starting this podcast, I really demonized the modern ways quite a bit and still do. Still my bias. Um, even though I'm a little hypocritical because we're here using technology and drive my
yeah,
car
true.
and live in a house and you know, but uh
uh,
but he mentioned that we're taking all these theories, these specific theories, all these different branches of science, and we need to bring them back together. We need to bring them all together. We can't
yeah,
talk about the microbiome without talking about the nervous system. We need to have we need to talk about anatomy, we need to talk about physiology or whatever it may be. It needs to come together.
full
And so I think
integration.
that's a great
Yeah,
way. Yeah,
yeah,
full integration. I think that's
full
a beautiful
integration.
point.
And so we need to get our heads together. I don't know how we're going to do that, but I'm the nervous system guy. Okay, we got another field. Someone who's expert in light, someone's expert in X and Y and Z, and I think Dan's pretty on to immunology or the lack of, um, and that's his place, and nutrition. And if we put our heads together and start talking, we actually will,
Mhm.
just like physicists, whether you agree with physics or not, That's the only way they come to really credible theories. And we're in this theoretical phase at the moment in terrain. You could say you're a theoretical biologist. I'm not sure if that's a real thing, but I think we need to find a new direction, and we have to work together, not against each other. And if you work against others because you say, "Well, they say this and they say that," they're wrong, they're idiots. A lot of people do that. That's not progressing the field. You know, um, it's about. It's not about each one of us our own opinion. It's about coming together and saying, all right, you say your thing, you say your thing, I'll say mine, and let's discuss.
Mm-hmm.
Um, and then we can actually get to the bottom of what's going on, and maybe we can have good arguments about it. But at the moment, there's just not really a mechanism for that.
Mm-hmm. Yeah.
Yeah.
Well put. Emrys Goldsworthy, thank you so much for coming on today. I really appreciate your time. Like I said earlier, I think that your vision with this is strong, and I think it's very important. And so I appreciate everything you do. Um, Vagus Nerve is an amazing book. I look forward to reading more work from you, honestly.
Yeah,
And
it's in the
every
works.
time we have these conversations, it's amazing.
Yeah, the next direction will be to convert that book into full terrain ideology. Um, that book is all about getting into doctors' heads and other clinicians' heads in their own language. That's why it's written in that language. But to get them more on this side, you've got to. It's like you've got to bring them over slowly. You can't speak in a different language.
Mhm,
So just be aware of that. Reading that is aimed to bring people out of the dogma in the direction of terrain. And so next, it's about putting together the book on the unified theory and the starting point. It's not going to be the definitive answer. It'll be the start of the hypothesis and the theory, and I think it'll be really helpful. And um, I want people to just have a broader perspective. That's the aim of bringing this content out. Yeah.
mhm. Yep, exactly. Thank you again.
Thank you for having me.
Absolutely. And I want to thank you all for listening. You should know that this is not medical advice. This is for your informational purposes only, of course. But remember, we're all sovereign, responsible beings, capable of thinking, criticizing, understanding everything. I think we really hit that nail on the head in this episode. Go and learn. That's what's empowering. You know, we're the people in the greater forest are together, self-healers, self-governable, self-teachers, and so much more. Please reach out if you have any comments, criticisms, concerns, whatever it may be. Love to chat about this stuff. You know where to find me on Instagram, beyond.terrain. And I really, really appreciate all of you who reach out to chat, reach out to criticize. It's just as valuable. I appreciate all the criticism just as much as I do the positive comments. Yeah, anybody who takes the time to reach out, I really appreciate. And take the time to listen to all these podcast episodes. I think they're so very valuable. And I think we're on the cusp of something amazing here. So yeah, I think we're on it already a little bit too. So yeah, if you like this podcast, give us a like, share, comment, review. You know what to do on your platform. And just remember, there's two types of people in the world: those who believe they can, those who believe they can't, and they are both correct. All right, guys, take care.